Hi, I'm Andrew Miller, and I'm going to talk to you guys a little bit about my favorite pediatric articles published in 2022 in Respiratory Care. A little bit about me real quick. I'm a section editor for Respiratory Care. I'm a pediatric RT and ECMO specialist at Duke, and I've received honorarium from SACS Communications and S2N Health. So what we're going to talk about, I'm going to talk about 5 original research papers. The links are all in the description, so feel free to read the full papers. This is just going to be a real quick overview. So the first paper I want to talk about is from Webb and colleagues about predicting high-flow nasal cannula outcomes in the PICU using the ROX heart rate index. So they enrolled kids that were less than 24 months, and you can see here this is the usual ROX index calculation here, and then you can see how they added heart rate here as an additional parameter to see how well it predicted in kids. And what they found is it appeared to be a pretty good tool, and it was highly correlated at 1 hour and 6 hours after high-flow nasal cannula initiation with high-flow nasal cannula failure. The second paper is from kind of the same group on the implementation of a pediatric ventilator liberation bundle. So they actually bundled extubation readiness testing, or SPT testing, along with a sedation protocol to examine what the effect was going to be on mechanical ventilation duration. And what they found was they actually had, you can see here clearly, a reduction in time on mechanical ventilation, which is good, a balancing measure, which is going to be similar rates of reintubation, and then importantly, there was no difference in unplanned extubation, so it appears to be a pretty safe and effective protocol. The next paper we're going to talk about is from White and colleagues on high-frequency percussive ventilation and viral bronchiolitis. There's a full video on our YouTube channel if you want to learn about this more in depth. And what we do know is that critical bronchiolitis is a very difficult patient population to manage on the ventilator. And then high-frequency percussive ventilation is used quite a bit as a rescue strategy for refractory gas exchange, but it's also used sometimes for secretion management. And what they found in this study was that use of high-frequency percussive ventilation resulted in improved CO2 clearance, and then conflicting data about improvement in oxygenation. But you can see here the OSI did not improve, but the SpO2 FiO2 ratio did improve, which means that this improvement in SpO2 FiO2 ratio is probably related to a higher mean airway pressure and maybe not so much a true improvement in oxygenation. Yeah, and the fourth paper we're going to talk about real quickly is on recognizing pediatric ARDS using the PALICC guidelines. And what this study shows us very clearly, and I think importantly, is that we don't do a very good job of recognizing pediatric ARDS in the PICU. So this means you can see here they didn't recognize about 2/3 of cases, and even in severe ARDS, so it kind of looks like they did a little bit better here, but they still only captured less than half, or so they recognized less than half. And then really importantly, neither group received protective tidal volume. And then even when they did recognize pediatric ARDS, they delivered very high tidal volumes. And then what's really interesting is that chest physiotherapy and other non-evidence-based therapies were mentioned 4 times more often than lung protective ventilation. So this is an area that we can all learn from their study and hopefully do better and implement evidence-based practice for pediatric ARDS. And the final paper is a very complicated study on the global and regional tidal volume distribution for spontaneous breathing mechanically ventilated children. So they used the EIT device to measure lung volumes as they decreased the pressure support and decreased the set rate on the ventilator. And they found that tidal volume and regional tidal volume distribution were not gravity dependent, and then the lung volumes did not change with changes in mode or decreases in support. This is a very complicated paper. I would really encourage you guys to dive in because it's got some really good, important information in there. And thank you for listening. Please follow us on Twitter. You can follow us on Twitter. Here's a link to our Facebook page, and please subscribe to our YouTube channel. Thanks for listening.